Okay, hi, this is Deana Schwartzkopf, and this is Health Assessment 6511, Advanced Health Assessment. And what we're doing here is the neurological part of the class. For this part here, what we're going to be doing is the cognizant, I guess, alertness and stuff like that. So ability to understand. So I've got a few questions that I'll ask Gary, and so here are some of the questions. Okay, what's your name?
Gary Knight.
And can you give me today's date?
February 3rd, 2014.
Okay. And do you know what time it is?
20 after 5.
Okay. And so you're pretty much, and where are you at this time?
803 South Jefferson in Plainville, Kansas.
Okay, so you're at your own residence and you're aware of that. Okay. What I need to ask you for as far as cognitive abilities would be, who's the President of the United States?
Mr. Obama.
Okay. And you know, you've already said what your address is, but and then the cognitive or the judgment part of this would be several questions that I would ask you, like, what does that mean that you can't teach an old dog new tricks?
People are set in their ways when they get to a certain age.
Okay. And what does that mean if I ask you that there's a light at the end of the tunnel?
There's hope.
Okay. And then the last thing that we would be looking for was somebody who's had like altered level of consciousness would be what we're looking for is if they're high on drugs, drunk, or stoned on medication, or having a psychotic reaction. And it's obvious that Gary is alert and oriented to person, place, and time. He knows what's going on. Can you tell me a significant event that happened yesterday evening?
Super Bowl.
Yes, very good. Okay, in this part of the segment, what we're checking on is coordination and fine motor skills. And what I need to do is have Gary do some specific movements. If he cannot do these movements, this would be indicative of a brainstem injury. So what I'm going to have him do first is I'm going to have you pat your hands alternately, pronate and supinate against your knees as fast as you can. And I'm going to lower the camera down to make sure that we can get that.
Like
and
that.
I don't know if I need to zoom. Yeah, exactly. Yeah. Yep. Okay. Okay. And then what I need you to do is hold your hands up like this, and I'm kind of fine. Shrink. Is that okay like that? Bring your hands up, and we'll do the fine motor coordination, and I need you to touch all of your fingers with your thumb. Very good. Okay. And now what I need you to do is touch your finger to your index finger to your... Oh, sorry. I'll have you touch your index. I'll have you, there you go, index finger to your nose, and then down to your knee. I'll do this. Nose, knee, okay? Other finger. Nose, knee, okay? And then what I need you to do, and we'll make sure that I'll be in this video here, is touch your finger to your nose, and then to my finger, so. Okay, touch back and then, okay, and then there you go. And just keep touching your nose and just keep making sure that you can touch my finger. Same with the other hand. Keep following. Okay. And then last, what I need you to do is I need you to take my finger and touch your toe. It doesn't matter which toe. Okay, let's make sure we can get that on there. And the same with the others. Okay, can you get that? Okay. Okay, next what I need to have you do is I'm going to have you close your eyes.
Can you zoom that back in?
No, I think you're okay. Go ahead and close your eyes and bring your arms out. Just close your eyes, and what I'm going to do is just have you hold your arms out for about 30 seconds, And what we're doing is we're looking for any kind of drifting of one arm or the other. This would be any kind of a stroke or a basilar skull type injury where one arm would actually drift. And you're doing pretty good there. Okay. Go ahead and open your eyes. Doing very good. Okay, and then the next part, what we need to do is I need to have you take your heel and run it down your shin. And I'm going to see if we can zoom in on that. Yeah, there you go. And just make sure that you can do that. Okay. So for this portion of the video, what we're going to be doing is we're going to be doing the bicep, or the reflexes, and basically we're going to start with the biceps, brachialis, biceps, triceps, brachialis, patellar, and Achilles. So what we're going to do, we start with the biceps, and I'm going to cradle your arm here. Have you relax your arm. I don't know if you can see that or not. And bring your arm out. There you go. Okay. And we'll do the same on the other side. Just kind of cradle your arm, just have you relax your arm. And I don't know if you can see that or not. I'm just kind of cradling the arm, and I'm gonna, and there should kind of be a little, there you go, up there. Okay, and then the next one is the triceps, and I'm gonna have you relax and just totally drop your arm. This is kind of hard to do. Okay. There you go. Jerk there. And just totally relax your arm here. And there's just kind of a tiny little jerk there. The next one would be the brachial radialis, and I'll just have you relax your arm. And when I touch here, I don't know if you can see that or not, a little bit of a twitch in the fingers. I don't know if you saw that or not. A little bit of twitch there. And just kind of have you relax. And a little bit of twitch. Okay. Then what we're going to move down to is the patellar area. I'll have you cross your legs. And on the patellar tendon, right above the tibia and right below the patella. And okay. And we'll do the other side. There you go. Okay. And then the Achilles, which I'll have you just go ahead and cross your legs for the Achilles tendon. If you could bring it back this way and just kind of, can you relax that hip? I'm going to take this sock off. Yeah. And what I'm going to do is kind of, there you go. And then I'll have you cross here. There's a couple different ways that you can do that. And one of the ways is to have them cross their leg. And there you go. Just relax. There you go. Okay. And then the other two that we can do, put your leg back down. I'm going to look at the abdomen. It's called abdominal. And what we're doing here is I'll just take my, it depends on the dermatome, but if I run my dermatome down, Gary's stomach should contract with touch, and this would be basically T7, 8, and 9. And then if I come up from T12 to T10, it should kind of contract a little bit. You can see that pretty easily when I went downward, but he's not laying down. The other one is the, I'm going to call it the, can't pronounce the name, cremasteric, and that's something that I'm not going to do. So those are the abdominal reflexes, but on the cremasteric, what we're looking for is on men would be cold reflex, where the testicles would move upward into the inguinal canal. It's a response that is normal, or needs to be normal, in order to protect the testicles from cold. If this doesn't happen, there's an abnormality there. Okay, so in this part of the video, what we're checking for is graphesthesia and sterognosis. And for sterognosis, I'm going to have Gary close his eyes. I'm going to place an object in his hand, and I want him to identify this object. So put that in your hand. I want you to identify that.
TV remote control.
Okay. And very good. Okay. And then what I'm going to do is I'm going to write a number on his hand, and I'm going to see if he can identify this number.
$261.
Yeah. Very good. And that's the number for his job duty. He's called by 261 when he needs to be called out for an emergency. Next, what I'm going to do is I'm going to check for the point location, and what I'm going to do is I'm going to lightly touch an area, and then I'm going to ask Gary to point to the area that I have touched. So go ahead and close your eyes.
Right leg.
Okay, I want you to go ahead and point to that.
Right leg.
Go ahead and point to it. Exact. Okay. Same.
Left knee.
Very good. Okay. All right. And then next, what we're going to do is a 2-point location. And what I want you to do is tell me when the 2 points become 1. And go ahead and have you hold your hand out.
That's gonna mark.
Close your eyes. Close your eyes. And I'm going to have you put your hand out here. Just tell me when 2 points become 1. 2 points? Are you feeling 2 points?
So 1 point.
You're feeling 1 point? Okay. How about on your leg?
Two. 1.
Okay. On the hand, there is a differentiation. Usually the hand is a little bit closer because the sensation on the hand will differentiate closer than the leg, and so there's a little bit of a differentiation, but that's pretty close. It's within a couple centimeters for differentiation. Okay, in this part of the video, what I'm going to do is I'm going to touch, have you close your eyes, and I'm going to touch 2 areas at the same time. And I want Gary to tell me which areas I've touched.
Sides of my legs.
Okay. And this is really important because if there's a partial paralysis or hemiparalysis, a patient would be able to identify one side but would not be able to identify both sides. Hi. In this part of the health assessment video, we're doing the 12 cranial nerves, and in this part what we're assessing for is the cranial nerves 1 through 12. What we're going to start off is cranial nerve 1, which is the olfactory. So Gary, what I'm going to do is I'm going to have you close your eyes, and I'm going to have you take your finger and close one there, doesn't matter which one, and then I'm going to place a object under your nose, and I want you to tell me what the scent is. I'll let everybody know what that is. You can tell me. Tell me what
Coffee.
that is. Okay.
Not good.
Okay, so that was olfactory cranial nerve 1. So for 2, what we're going to do is we're looking for the eye movements, and for 2, what we're looking for is constriction, and we're also looking at the disc and the optic nerve. Is we're going to be checking for the ocular movements of the eyes. So we're looking at motor cranial nerves 3, 4, and 6. And what we'll do is the 6 cardinal signs. So I'll just have you watch my finger. Have you go up. Don't move your head. Down, out, down, down, up, down. Okay. And what we're doing is we're looking for ocular motor movements for 3, 4, and 6, and any kind of abnormalities with that would let us know that there's any kind of a lesion going on there. Cranial nerve 5, what we're going to check for is trigeminal. So what I'll do is I'll check the temporal area, and I'll go down to trigeminal and just have you go ahead and just clench your teeth. Okay, and then just move your jaw from side to side. Okay, and there's no problems there. And so then what we're going to move on to is 7, and cranial nerve 7. What we're looking for is any kind of a facial nerve paralysis or problems. So I'll just have you smile, frown, okay, wrinkle your eyebrows, okay, and then puff out your cheeks. There you go. Okay, that's cranial nerve number 7. And then number 8 is hearing. And so what we'll do is I will use the, we can do the Weber and the Rhine test, and we can also do the whisper test, but I'll do the Weber and the Rhine test. So, strike this on your forehead. Tell me if you hear sound in both ears.
Mm-hmm.
Okay, vibration, both ears. Okay, and on the back, I'm going to put it on the mastoid. Tell me when you no longer hear that.
Yep.
Okay, can you hear it?
Yeah.
Okay, I'll do the same on this side. Tell me when you can no longer hear that.
Okay.
Okay.
Mm-hmm.
Okay.
Yep.
All right, and that's telling me that the acoustic or the nerve 8 is working fine because he's hearing air versus bone conduction without any problem. The next one would be 9 and 10, which is the soft palate and the swallow reflex. So what I'll have you do is I'll have you go ahead and swallow. Okay, and no difficulty swallowing. And what I'm going to do is have you open your mouth and say "aw." Turn this on. Okay. And just, I'm looking for him, go ahead and say "aw." I'm looking for him to be able to move the soft palate. Any kind of stroke or abnormalities of this cranial nerve would not be able to lift or move the palate or swallow, so they would have trouble talking or swallowing. And that would be 9 and 10. And then for 11, what we're looking for is the shrudge to be able to lift their shoulders up. So what I'll have you do, put my hands on your shoulders and just have you lift your shoulders up. The other thing. Okay, so for this part of the test, what I'm going to do is what's called the Romberg test. So Gary, I'll have you look at me, close your eyes, and what I'm looking for is any kind of swaying or any kind of balance problems. And doesn't look like there's any problem there. Okay. And then what I need to have you do is tell me, keep your eyes closed, and just tell me where your hands are located.
On my side.
Okay. And where your feet and knees are located.
Below my hips.
Okay, can you lift your knees up? Yeah. One knee, the other knee. Okay. And now what I need to do is I'm checking for your gait. I'll have you walk towards me.
My eyes closed.
No, open your eyes and just walk toward me, and then stop, turn around, walk back, and then what I need you to do is heel toe. There you go. Okay, and then walk back, and then walk back on your toes. You can walk back on your toes. Okay, and then walk on your heels towards me. There you go. Okay, and that's good. What this is telling me that if there was any kind of a Achilles tendon rupture, he would not be able to walk on his toes, and if he had any other kind of brainstem abnormalities, he wouldn't be able to do the heel-toe coordination walk.
The last one, cranial nerve 12, I'll just have you go ahead and stick out your tongue and say, okay. Any deviation to the left or the right would signify that there's brain abnormalities on the side that the tongue deviates to. And at this point, there's no problem with that.
Okay, so for this part of the test, what I'm going to do is what's called the Romberg test. So Gary, I'll have you look at me. Close your eyes. And what I'm looking for is any kind of swaying or any kind of balance problems. And doesn't look like there's any problem there. Okay. And then what I need to have you do is tell me, keep your eyes closed, and just tell me where your hands are located.
On my side,
Okay. And where your feet and knees are located.
below my hips.
Okay, can you lift your knees up? Yeah. One knee, the other knee. Okay. And now what I need to do is I'm checking for your gait. I'll have you walk towards me.
My eyes closed.
No, open your eyes and just walk toward me, and then stop, turn around, walk back, and then what I need you to do is heel toe. There you go. Okay, and then walk back, and then walk back on your toes. You can walk back on your toes. Okay, and then walk on your heels towards me. There you go. Okay, and that's good. What this is telling me that if there was any kind of a Achilles tendon rupture, he would not be able to walk on his toes, and if he had any other kind of brainstem abnormalities, he wouldn't be able to do the heel-toe coordination walk.